Welcome back. My name is Ken Rethmeyer. I hope you are a returning audience. If you're not, if this is the first one, welcome. It is my pleasure and distinct honor to offer you an opportunity to learn a little bit more about some tools and models involving the leadership journey that we're all on. And it's my pleasure to use my book, The Leading for Value, the name of the podcast and the book, as the foundation. There are 4 chapters. Each chapter is designed around a specific model that I developed over time during my own leadership journeys. And the tools I've attached to those models are designed to complement those in such a way. But I can tell you, you can use the tools in any kind of format. It's not restricted to what you may see in these podcasts. But as you can see above me, to me, leadership is a very important process. And it's something you just have to do. You can't wait. You don't want to wait. You want to get involved. And I learned that very early on in my own leadership roles, actually starting in school and going from there into multiple careers, if you will. And this podcast is episode number 9. And in this one, I'm going to start sharing the screen with the PowerPoint. We're going to be spending some time looking at a model that was developed a few years ago, and it's involving strategic thinking. And I can tell you that most every leader will tell you, hey, I've done that before. Don't need to do it again. Well, my purpose is to tell you a little bit about how I see it, and from my perspective, how I used this model in some of the organizations I did consulting with, and also, interestingly enough, in some of the work that I've done with some of my Eastern European colleagues around how they're going about the process of changing the way they're doing business in their healthcare systems. And so therefore, this particular model was developed a number of years ago. I was partnering with a professor out of Brandeis University. We were working with the Robert Wood Foundation on a project known as Community Partnerships for Older Adults. And I'll go into that in just a few minutes. So in this particular episode, we're going to talk about the model, the 4 or 5 steps that are involved, and then I'm going to apply it to one tool that will be attached as a handout so you can print it off if you want to. And all of these podcasts are both video and audio. I've had a lot of people ask or tell me they're going to listen to them. Well, you can, but I recommend that you watch. And so in your own thinking, I'd like you to think about, in your own history as a leader, what was the model, what was the approach you used to transform that vision that you had for your organization or your group, your team, into reality? What was the model that was used to develop those strategic initiatives to make sense? And that's a very important task, and I hope you will do that. And as a consequence, you will also have an opportunity to think a little bit more about how this model might apply in your current setting. And the whole idea is that, if you think about it, it's a combination of both critical thinking and creative thinking. The creative thinking, ideation, if you will, is all about brainstorming and thinking and putting out on the table, if you will, as many ideas as you can about how we could transform the vision that we're looking at and we're going to be using over the next few years, for example. What are some of the kinds of initiatives that our organization, the community we serve, or others need in order to be successful for them as well as you? So as a consequence, you're going to see the model, and I'm going to try to mix between ideation and implementation. So it's, in my mind, it's not what could be or what can be, but what are we going to make it happen? So here's the model. Strategic healthcare planning, a model. I used the model from the Robert Wood Johnson Foundation work that I did on community partnerships for older adults and transformed it into a healthcare application. Very simple. It can be applied to any industry you want. Just a matter of changing just some of the words, but the idea is basically the same. And in the case of the Robert Wood Johnson Foundation effort, what we were doing is working to develop some guidelines and support for 13 communities that had been selected by the foundation for funding in helping them develop processes and opportunities to teach older adults how to better navigate their healthcare system. If you think about it, as we age, complexity gets greater. In the healthcare system today, there are all sorts of avenues, all sorts of pathways you can follow. And we saw this was a challenge with adults, older adults. And so what we tried to do is bring it down to more simple context, as well as helping those communities. And I can tell you, all 13 did a great job. So the model is here. It's aligned around three major elements or umbrellas, if you will. Focus, that's the vision, values, goals, and objectives. Alignment is how do we create initiatives or strategic efforts to implement that vision. And then the momentum is how do we keep it going? And there's a number of things that we'll be talking about in this episode and the next episode, episode 10, because it's not a straight line, as you know, on any respect. So what we're going to do is I'm going to walk through these parts with you, and then we'll look at one model on developing a process to select the best strategic initiative. So let's say, getting started, it's important for the leaders to understand that in an effort like this, it is very helpful for everyone to establish ground rules, a mission. You organize your stakeholders, making sure that they have a commitment to be part of this whole process. And the key there is ownership and commitment from the standpoint that you want them to feel like they're part of the contribution that's going to be made. And then the internal communications. And I have to tell you, in the work that I've done with organizations and my own studies on leadership, I think one of the best definitions of the word power for a leader is the ability to absorb uncertainty. Let me repeat that. Power, the ability of a leader to absorb uncertainty. I have to tell you from my own personal experience, I was involved in 3 organizations that were going through major, I'll use the word mergers or acquisitions, and displacements. And one of the most difficult challenges that I had as a leader in one organization, which remained nameless, was having to downsize by 1/3 of my staff. It was heartbreaking. And all I could do was my best to try to make it as easy as possible, if that's even a reasonable expectation. But what I learned from that was the more uncertainty that I absorbed, that made it a little bit easier for those that I was dealing with. And so you translate that in a positive framework of doing something working forward and a new effort, organizational effort. Those ground rules, those abilities that leaders have to absorb that uncertainty does a long bit to help participants feel better about what they're doing. So that's sort of step number 1, if you will. And then the focus then turns around, and what you want to do is create a vision that can be shared. And what we mean by shared, I own part of it, you own part of it, the team owns part of it. I'll go back to my Disney days. When you stepped out in the park and you were on stage, you were living the vision. When I was on active duty, the same thing. When I was developing learning centers in 2 organizations and helping to create executive leadership programs for then the old Wachovia, the blue Wachovia, we called it. My job was to be able to go out and develop a shared vision so that anyone that got involved and we had 35 participants each year in the old Wachovia Executive Leader Program, that they felt that they were part of the whole process and they were really engaged. So in this case, for healthcare, it's targeted health. I can tell you in Romania, one of my colleagues who works with Mark Sharp and Dome, they're working very diligently on trying to change the pathways of identifying patients with cancer for early detection and treatment. That's what I call secondary prevention. Tertiary prevention is they've already got it, and the targeted health, all you can do is try to help them feel better and treat the cancer as best you can. The goal would be primary prevention, and that is targeted health at those people who are more likely to become cancerous and have that disease, and get them involved in some kind of activities for health improvement and a preventive measure. And in this case, for the kind of work that you might be doing out in the community, for example, regardless of whether you're a for-profit or not-for-profit organization, you have stakeholders, and those stakeholders have an important role to play. You want them to be linked in very closely because they're going to help you. And especially in healthcare, for example, when you can link in other kinds of components of the healthcare system, they are all involved. It's a much better team and more effective. And then the next thing is the information gathering. In the case of healthcare, I can remember when I was with the Hospital Association of Pennsylvania, we got a hold of 14 databases of healthcare statistics and other kind of related information. We combined it into one database, and then we created, and I showed you in one of the other episodes, the Appleseed approach of community needs and assessment, and then use that in a way to design and develop interventions to improve healthcare in the communities those hospitals were serving. So it's the needs assessment, resources, analysis, and interpretation. And that analysis and interpretation is a combination of a little bit of creative thinking, brainstorming some ideas, and then critical thinking, and that is zeroing in on what are we going to do as we move forward. And then priorities and planning. And this is where it turns from ideas into reality. And the purpose here is to have strategies that are workable, that will produce measurable results, both in terms of the quality of the care and the cost of the care. Because what we're trying to do is optimize the value of the investments we make, for example, in healthcare. I did the same thing, and interestingly enough, with the organization that was in the oil industry. Mechanical services, what they provided. And what we did is we developed a strategy to get them more involved in sort of a partnership with the oil companies that they were working with, so that when it came time for moving from mechanical services maintenance to turnarounds, that's where you shut part of the refinery down and you bring in the people to rehab all the equipment. We wanted that to be an easy transition. So the strategy was to get that company arm in arm with the organizations they were providing services to, so that they would be the first ones that companies would look at to say, I need you to do that turnaround. And the idea there is to develop plans for implementation that really work. And that's important. And it's tough. It's not an easy process always. And then finally, measuring impact. And it's not just a one shot, one deal. It is a daily basis or a monthly basis. In the case of the company that was in the mechanical services end of the oil industry, that was a daily basis, especially on the turnarounds, because every day counted, and they were working with a tight agenda, very direct, and the same thing with healthcare. In Europe today, in Romania, as I mentioned earlier, their focus is on cancer, trying to get a good hold of that. And I can tell you, one of the people, Luca Simpleton, is a great leader in MSD, Mark Sharpendome, and she is leading the effort and doing a great job. So kudos to her for what she's doing, and they're measuring impact on a daily basis as well. So it's program adjustment. And the idea here is that if you see something not working quite like it should, you want to be able to adjust it. And then at the end of the day, every single day you're doing it, celebrate your successes. And that's very important because that gives the people who are involved a real sense of ownership. And as a consequence, you can't do any better than that. And then finally, what a lot of people don't pay attention to very much, but I think is really critical, and that's the feedback and continuous improvement. And actually, that arrow could have gone back to each of those 4 previous boxes, not just getting started. It could have gone back to the shared vision, information gathering, and priorities and planning. And that's the way you have an interactive process. And as a leader, your job is to ensure that you're getting the people who are targeted in those areas as experts, get their involvement actively so that you make sure that when you get done, everything goes as well as it could possibly go. And here's some of what we had to talk about in terms of the Robert Wood Johnson Foundation, community partnerships for older adults. And I can tell you it was interesting to watch these communities as they develop their own efficient and effective paths to help older people get involved in the healthcare system and their own healthcare in a very active way. Because when we do, we have ownership of our own health. And in this case, there was focus, vision, values, goals, and objectives, alignment, the strategies, the data and analysis, and effective plans so that people knew exactly what they could do and how to do it, and momentum, and that's those monitoring indicators, adjustments, and measuring impact for continuous improvement. And that's what it was all about. We had a great time. It was a lot of fun, and I think it was a very productive way. And I used that same model in other work that I did before I started my own organization. So again, thank you for your attention. This concludes episode 9 of Leading for Value series. And I hope that that model was helpful for your thinking. I will be attaching a material so that you'll have it in the next episode for sure, but I will add an episode, and that's episode 10. In this one, I will be adding material that will show the model, and you can print it out for your own use. Thanks again. I sincerely appreciate your help and your process and being part of this series that I'm doing. Remember, it's not what I can and cannot control. It's what I want to do. And with that, we'll talk about that in the next episode. So again, I want to stop sharing the screen. Thank you. I sincerely appreciate your participation. Oh, I got a welcome from the local Alexa. How about that? Thank you very much and take care. We'll see you next time in episode 10.